Are doulas appropriate for every type of birth? How might doula support differ based on the type of birth you have? How can doulas facilitate informed and respectful discussions in the hospital? We get into all that and more in this episode with doula Hehe Stewart. Welcome to the All About Pregnancy and Birth podcast. If you're having a baby in the hospital, you are giving birth in a system that too often takes away power from women over what happens in their own bodies. I'm Dr. Nicole Calloway Rankins, a practicing board-certified OBGYN who's had the privilege of helping well over 1,000 babies into this world. I've been a doctor for over 20 years, and I'm here to help you take back your power, advocate for yourself, and have the beautiful pregnancy and birth that you deserve. This podcast is for educational purposes only, and it's not a substitute for medical advice. Check out the full disclaimer at drnicolerankins.com/disclaimer. Now let's get to it. Hey, real quick, before we get into this episode, my new and improved online birth course, The Birth with Power Pathway, is coming in May. If you want to feel calm, confident, and actually prepared for your hospital birth, this is for you. The best way to be the first to know when it drops, join my email list at drnicolerankins.com/email. Hello there. Welcome to another episode of the podcast. This is episode number 247. Whether this is your first time listening or you have been here before, I am so glad you're spending some time with me today. HeHe Stewart is the founder of Tranquility by HeHe Maternity Concierge. She's the creator of the Birth Lounge and Dad Days, a birth prep course for fathers. With a master's degree in human development and family studies and 10 years in the family life education field, HeHe helps women prepare for childbirth with research-backed education and expert support to have a confident birth experience while feeling informed and in control of labor without fear or coercion. She and her team serve pregnant people and their families across the U.S. and internationally with prenatal, birth, and postpartum care. HeHe also hosts the Birth Lounge podcast, which has over 60,000 listeners in over 28 countries. The show features leading experts in pregnancy, myself included. I've been a guest on the Birth Lounge podcast and enjoyed it. Also experts in women's health and childhood development, so parents can understand how to have an informed and confident birth. There's so much great information in this episode. HeHe and I chat about what type of support you should expect from a doula during pregnancy, what type of support you should expect from a doula during an unmedicated birth, during a labor induction, during a medicated birth. We talk about what type of support you should expect from a doula for a planned cesarean birth, and even what type of support you should expect postpartum. We also cover her thoughts on doulas as advocates. Actually, not all doulas feel comfortable being advocates, so we chat about that, and then some misconceptions about doulas as well. So you are going to learn some great information in this episode today. Now, some other great information I have for you is inside of my free birth plan class, Make a Birth Plan the Right Way. A birth plan is so important to help you have the birth that you want. And you have to do a birth plan in a way that's actually going to work to help you have the birth that you want. So what I mean by that is that those templates and forms that you find online, you print those out, you take them to the hospital while you're in labor, those don't work. You really need to have a discussion well before you get to the hospital about your birth plan in order to make sure that the doctor and hospital actually support what's in your birth plan. If you wait until when you get to the hospital to show folks your birth plan, that is too late. And actually just showing folks your birth plan, period, is ineffective. It needs to be a discussion. So inside of my free birth plan class, I teach you exactly how to have that discussion, what questions to ask, what text and things to put in your birth plan, so it's more likely that people will actually support it. So register for that free class today. It is at drnicolerankins.com/birth plan. Okay, let's get into the conversation with HeHe. Thank you you so much, HeHe, for agreeing to come onto the podcast. I'm excited to talk about all things doula.
Thank you so much for having me. I too am very excited. I could talk about doulahood and doulaship all day long.
All right. Love it, love it, love it. So why don't we start off a bit by having you tell us a bit about yourself and your work and your family.
Thank you. Well, I just got married in October.
Oh, you're newlywed.
We are newlyweds. We have been together for 10 years, so we are not a new couple, but we are newlyweds, and it's been so much fun. As far as me and my work, so I'm the founder of Tranquility by HeHe. We're a maternity concierge. We are a comprehensive education support system for parents planning for a birth. I have a master's in human development and family studies. And so the approaches that I use in order to prepare people are going to look at the family as a system. And so it's going to look at a multitude of different interactions and crosshairs of people and dynamics that we need to think about in order to craft your ideal birth. And this is going to be people in your immediate circle. So your partner and your family and your baby and nature, but also people in your kind of those outer rungs of your circle too. So your provider and the nurses that are on call that day and any specialists that you may need and anybody else that's in your care, like chiropractors, acupuncturists, doulas, whoever you choose to put on your care team.
Sure.
There's always going to be these dynamics that we need to take into account in order to craft your ideal birth. So that's a lot of the approach that we use.
Okay. That was my next question. Like, what training have you gone through to do the work that you do? So obviously your master's degree informs that. What about specific training related to being a doula?
Yeah. So I took a DONA training in 2016 to kind of see what doulahood was all about. I have not kept up any certifications. My personal beliefs around certifications is that there needs to be some sort of standardization. Right now, certification programs get to almost make up whatever they want to be the criteria. And I struggle with that. And so it's not something that I've subscribed to, but our whole team holds at least a 4-year degree. And then in order to be on our team, you have to have a minimum of 3 years childcare experience. So it's a different type of background, but still very kind of acutely in that family dynamics realm.
Yeah. So this is a big point for me is people knowing like the background that people come from, and
Totally.
doulas can be pretty tricky because you can kind of just sort of say that you're a doula. So I appreciate that not only are you you've done doula training, but you have your other educational background that informs this, and you have some standards around who can work with your organization. So I think that's really meaningful and important.
Thank you. Yeah, we take a lot of pride in our team and the quality of care that we give. And, I think that sometimes it can be difficult to work within the hospital system, and it can almost feel for clients, for our patients, that they're being tugged in two different directions. And our team really prioritizes trying to work with the medical team to help promote cohesive care. It's really important to make people feel safe that they are receiving cohesive care. Finding a doula is kind of tricky. Like you said, like anybody can call themselves a doula. So knowing your philosophies around things and that it aligns with you is also really important.
Gotcha. So you yourself do not have children.
I don't know.
Then what brought you to this work?
Yeah, good question. So that master's in human development and family studies, I started out with a brief time, about 8 months in early intervention. That just wasn't for me. So then I went back to my roots, which was early childhood education in toddler and infant classrooms. And I began to realize like, wow, parents are really struggling when they drop their children off for the first time at daycare. And so I started to unravel like, well, what's leading to this? And they're feeling a lot of emotions. There is some excitement because you're going back to work and you get some normalcy back. And a lot of people crave that, right? And that is immediately generally followed by guilt of like, oh my God, I must be a bad mom because I'm excited to hand my kid off. That is not true at all. And then there's some angst of like, oh my goodness, I am leaving my baby with some people that, I trust, but I don't exactly know, especially on the first day of dropping your baby off. And so when I looked back into this, I started to realize that there's a lot of things that we can do to help parents transition into postpartum easier, make that transition better for them. And one of the things that kept popping up is birth trauma. And so then I started to unravel that, and I thought, oh my goodness, holy cow, there's so many things that people need that just the hospital system isn't designed to give. And so who's filling in those gaps? And that's a doula's job. And so that's kind of how that happened.
Got it. Okay. I love it. I always like to hear people's stories about how they end up where they are. So let's hop into talking about doula. So what exactly, I think a lot of people know what a doula is, but let's just go ahead and define it. What is a doula?
Yeah. So a doula is a non-medical support person for people who are having a baby or have recently had a baby. Most doulas typically do like 90 days after birth or through 1 year, right? We provide emotional support and educational support and advocacy support. And it looks different for every doula. So personalities and philosophies and communication styles are all going to play into your doula and the field, the energy, your connection with them.
Gotcha. And that was one of my questions. You mentioned advocates, doulas as advocates. I see kind of like going back and forth. Like some doulas don't necessarily feel comfortable and maybe they want to do just more the physical and emotional support. What are your thoughts about that? I think it's fine as long as people like say what they're doing and what they're able to offer. But it sounds like you have decided that advocacy is an important part of what you offer.
Yeah. So you've circled back a little bit to that certification piece. So I think certifying organizations teach different things. Some of them teach you to be a part of that care team and be an active participant. And then some of them teach you that your role really isn't to interact with medical providers. I have taken a couple of different doula trainings over the years just to kind of see what flavors were out there. I took some from each doula training. One thing that our team does is we are an active participant, but we do it in a way that is very respectful. So instead of using very direct statements, we might be in a situation where, let's say the provider is wanting to introduce Pitocin and our client has said, I don't really love that idea. Let's talk about the risk and benefits. The OB does a great job of explaining things. And then at the end, that client says, I like really don't know. I'm not sure. And the OB goes, you know what? Let's just try it. So we're going to get you hooked up. Our team might step in and go, oh, can we just pause really quick? Lauren, you look really uncomfortable. It doesn't look like you're super sold on this idea.
Right.
Do you have more questions that you'd like to ask? I want to make sure that you feel good with the decisions that are being made here. And while we have Dr. Jones here, we should use this time to ask our questions.
Gotcha.
And then our client can say like, yes, actually, I am so scared of this. I really have a preference for this. Or they might say, I just don't know what to ask. And we could say, okay, do you have questions on the dose that they're going to start? Do you have questions on getting the IV because you're going to need that? Do you have questions on how this might change your labor in a few hours? And then our client says, yeah, all those. Can we all those? And so it's more of a facilitation of a discussion rather than like, no, stop. She said, don't.
Gotcha.
She doesn't want that. A doula's job is really to center that parent's, that mom, that birthing person's voice. You want them to be the decision maker in the room, but you don't want to alienate or isolate the medical team in doing that because they are critical to the care. We're all part of the team. So we have to act like team members.
Yeah, absolutely. I love that. That's a really great way to put it. Let's talk about something most pregnant women aren't getting enough of, omega-3 DHA. The recommendation is over 200 milligrams a day, but less than 5% of pregnant women in the U.S. meet that. That's one of the reasons I love Ritual's Essential Prenatal. It has 350 milligrams of vegan DHA, plus other key nutrients like methylated folate and choline to support baby's neural tube development. As an OBGYN, I appreciate that Ritual goes beyond the basics. The formula is science-backed, third-party tested for heavy metals and microbes, and every ingredient is traceable. And the delayed release design, it's gentle on the stomach, something that really matters, especially if there's trouble with nausea during pregnancy. You deserve to know exactly what you're putting into your body, especially when it comes to prenatal multivitamins. And with Ritual's dedication to traceable science and sourcing, you always will. See for yourself with 25% off your first month at ritual.com/Dr. Nicole. Start Ritual or add Essential Prenatal to your subscription today. That's ritual.com/Dr. Nicole for 25% off your first month. So let's talk about the different ways that doulas can offer support. Why don't we start off with what type of support should someone expect from a doula during the pregnancy, like during the prenatal period?
Good question. So this is very individualized to doulas. This is why you should ask questions in interviewing doulas. How many prenatals do you provide me? When do you go on call for me? If I were to have my baby early, what would that look like with your care? How would that impact things? Do you work in a team? Is there an on-call schedule? Do you have a backup doula? All of these things are going to be important. That question that you just brought up of, tell me how you interact with hospital staff.
Sure.
Some people are going to say, I'm a very active participant, but I do it in a respectful way. And some people are going to say, you know what? That's really not my role. I leave that up to you, but I provide a lot of physical support, right? Many doulas do 2 or 3 prenatals, so that is pretty standard. Some doulas, like our team, we meet with our people 8 to 10 times before their birth.
Shut up.
Yeah, no, we're doing full childbirth education.
Okay.
We spend about 4 or 5 hours making a birth plan because we are teaching you how to have your ideal birth, but then also 2 other things: how to not have the birth you don't want, and how to avoid going down the paths that a lot of births go down. So these common patterns of twists and turns that we almost could have predicted, we teach you how to hopefully avoid that. And then if you need some of the tools along those routes, how do you appropriately use that? So Pitocin is not a bad drug. It gets a bad rap. But there are places where you want to use Pitocin. Now that we've established those places, how do we use them? What questions should we be asking our providers? What preferences should we be telling them? Like, I really would like to start low and slow.
Sure.
I really would like to start with non-medicinal ways to induce.
Right.
I'd love to start with the balloon because it's not a medication. People have all sorts of preferences.
Sure. Okay. Love that. So then what type of support should someone expect from a doula during an unmedicated birth?
Great. So a lot of hands-on support for pain relief mainly, right? A lot of verbal support too, probably. They are coaching you through each contraction. So as your contraction builds, your doula is probably saying some form of like, all right, take a deep breath. You're doing an amazing job. Here comes this contraction. You know what to do. And then they kind of let you have your contraction and it's quiet. That's how we want the room: quiet, calm. You're doing your thing. And as that one ends, they say, take a deep breath. You never have to do that contraction again. And your baby is a little bit closer to meeting you. Melt back into the bed and let us know when another contraction comes.
Right.
And that's what your doula is kind of doing: physical pain relief and that emotional encouragement and support. And then I think advocacy as well, involving your partner if they want to be involved too.
Got it. So you mentioned partner. What kind of partner support do doulas or should people expect from their doulas to provide?
Yeah, another really great question for your interview with your doula because it is going to be very individual. But you want your partner to be on the same page as you. And so hopefully your doula is able to facilitate that in some way. Maybe they are putting together documents for you guys to read over together. Maybe your partner comes to prenatals with you. Maybe your doula comes to your home. Some doulas just do virtual support. Some do a hybrid of virtual and in-home, and some do everything in home. Know about your particular doula. And then you also want your partner to have some sort of pain relief knowledge, because there will be a time, most likely for everybody, that their partner is the one person that is constant in that space in labor. You're going to want them to know how to help you breathe, coach you through a contraction, give you hip squeezes or sacrum presses or that fantastic hand rub that makes us all just like melt, right? Head scratches, shoulder squeezes. There's so many things that they can do that are very simple to employ, but very effective in terms of managing pain relief.
Awesome. Okay. So what type of support should someone expect from a doula if they end up having an epidural? And they know they want to have an epidural?
Okay, so kind of the same thing. A lot more emotional support. I think there's a lot more downtime typically with an epidural. And so I find that with an epidural, I get like chatty time with those clients. A lot of times I ask to see like their wedding video or wedding pictures, or I say like, how did you guys meet? Like, tell me your love story. it's a really fun way to kind of get to know them a little deeper and also get that oxytocin flowing. But with an epidural, hopefully your doula is aware of positions that they can get you in that are epidural friendly and also maximize the space in your pelvis, because you're depending on nursing staff, they may not have the time to come in and truly flip you every 30 to 45 minutes. And we know that that's pretty important.
Yeah.
So having a doula that can give you those positions and help you understand like what we're doing in each position, the intentionality behind it, super important. And then I think just advocacy, again, in every stage, it's going to be advocacy, but with an epidural, that advocacy can sometimes look like calling the nurse because that person feels rectal pressure, or calling the nurse because that person has, hip pain that we can't get rid of. And we've tried several positions and we'd love to hear our options. Like, should we call the OB back? Do we need to call anesthesiology? Should we talk about different options for the epidural? Facilitating that conversation again.
Okay. And then what about for a labor induction? What does doula support look like for someone who's being induced?
Very good question. Again, a really good question for your interview for your doula. It's going to look different for everybody. What our team does and what we prepare people for is, inductions are long. And so you want to think about everyone's battery. At the end of an induction, if it is on the longer side, you and your partner might be feeling a little tired or a little run down, and you're going to want your doula to have adequate energy to really be able to support you. So your doula doesn't need to meet you at the beginning of your induction. They should still join you the same place that they would join you in unmedicated labor, which is typically active labor, or a place where you feel like you need extra added support, or a place where you feel like, okay, I'm not being able to advocate for myself. I don't necessarily need pain relief options, but I do need help speaking up because I'm just feeling, discouraged or sad, or I just feel not heard. And I'm hoping that someone can come in and help me. So those are the three places that we say have us join in an induction. But again, every doula is going to do it different.
Okay. And that was my next question. When in general, and it sounds like you answered it, I don't know if you want to add any more. When in general, regardless of the type of birth, would you expect that the doula should come meet you in the hospital? Because I do see that sometimes where people feel like they have to some people say, not that they have to beg their doula, but it's almost like it's a lot of phone conversation and they're wanting their doula to come. So what should be a good time that a doula should come?
Yeah. So whenever you want that support, whether it's physical support or advocacy support or even emotional support, just letting you know, reminding you that you're safe and that this is normal and this is what we expect your body to do. Even if you're feeling a little scared, this is expected. You should call them. So we have a rule on our team that as soon as a parent says we're ready for your support, our next answer is we're on our way. Every single time. We do not hold the authority to determine when it is best to join someone. Now, what we do is inform people. Don't forget, we have a battery too. So it may look like if your doula is working with a backup doula, you may have to swap up and have a backup doula. If you're on a 24-hour call schedule, when the clock turns, you're going to have a new person. If you're working in a team, they may swap out. So just think about that. But you don't necessarily need to be having them have their hands on you or be doing pain relief if you're not feeling heard. They can definitely come in and just hold that space for you to have your voice heard. Sure.
I love that. So then what about for a planned cesarean birth? Do you think someone needs a doula for a planned C-section?
Yeah, absolutely. So our team attends planned C-section. We just had 2 last week, actually. That's what I was just thinking about. We join you right before your surgery for that. So that's a little bit different because it is a procedure. We're let in right at the end of the OR. You are almost always already prepped and in the OR before we are called back from the waiting room. So we almost never cross paths until we're actually in the procedure. Your partner will join you right at the very end, right before your procedure starts, and we get let in either with them or right after them. We don't get let back in your triage room either. So you're going to be held in kind of a room before your C-section starts, typically, unless you're the first one. We don't get to be back there typically. It's just you and your partner. And so
that's interesting. That's a total hospital.
Really?
Thing.
Oh yeah.
Yeah. Cause in our hospital, doulas can come back whenever.
Really? That's pretty consistent across Hospitals here, it's dependent on the nurse. If the nurse isn't care, they'll be like, yeah, come on back. It's not a problem. But for the most part, they, in our bigger hospitals too, especially when they get busy, they will put two families in one room and just put a curtain. So they really do try and limit
got it.
like the number of people.
Sure. And where are you? What area?
In Boston.
Okay.
In Massachusetts. Yeah. New England. But we'll join you right before your surgery starts. And then that looks like a lot of two things: distraction, just keeping your mind somewhere else, reminding you of like, while we're there, your baby's coming. And then the second thing is just reminding you that you're safe. A lot of people who have past birth trauma, either with a C-section or have chosen a C-section because of past birth trauma, really benefit from having someone there that is not their partner. That is just a third party to say, like, you're safe. You're in great hands.
Yeah.
We're going to meet your baby in like so soon. Just a few minutes.
Awesome. So then what about in the postpartum period? What type of support should someone expect from their birth doula? And because I know you can have a separate postpartum doula, but what should they expect from their birth doula in the postpartum period?
So typically your doula is going to say a little bit after your birth, like immediately after birth. A lot of people will go home an hour or two after your birth, or when you transition to postpartum, ask your specific doula what they do. But then for birth doulas, it kind of varies. Some people, that's where your care ends. Some people, you get 1 or 2 or 3 visits with your doula just to debrief. Some doulas, so our care being so comprehensive, some doulas have extra training in lactation, in formula feeding, in bottle feeding, in early intervention. So think about kind of what you want in postpartum and whether your birth doula offers it. And then, like you say, if they don't, you can shift right over to a postpartum doula and continue that really great support.
Okay. I feel like I would expect that there would at least be like one visit to sort of debrief or talk about, or at least like check in and see if they need any additional resources or anything like that. But as you said, it's important to ask questions so you know exactly what you're getting.
Yeah.
So you talked a little bit about this earlier, and I mentioned it. So doulas have the same issues that obstetricians face in the sense of work-life integration, and birth is unpredictable. And how do you have a life when you need to be available? So how do you do that? And how have you seen the profession in general adapting to that?
Okay, so when I first started being a doula in 2016, one of the biggest things facing the doula industry is burnout. And I just was so discouraged because I had just gotten in the industry and I was like, wow, if all these people are so burnt out after just a few years, what are we going to do? So I decided to work with a partner, not a backup, but they truly were a partner with me on every birth. And it lessened my load by, let's call it 50%. It felt like we were equal partners on every birth. Then I was just new in business and gosh, I was taking 5, 6, 7, 8 births a month and just running myself ragged, right? She and I together, we were just hitting the ground running. And then I realized, the care that people deserve is not the care they're getting when I take 8 births. And so I knocked it down and we've bumped it up throughout the years. And so I think it is about finding the number of births that is comfortable to you that you can still give quality of care. I also have week. So ours is 4th of July. TBH, Tranquility by HeHe, is closed the week of 4th of July and the week of right before Christmas all the way till the new year. And that is standard and we get it off every single year and we do not take births. And so that's really important, is setting boundaries around that. People still inquire about that time and we will be very upfront with them and they'll say, my due date is July 6th. And I will say, okay, great. We are happy to work with you. Please understand our office is closed from 7, 2 to 7, 5. And if that's a risk you're okay taking, it's just 2 days before your due date. So if you're a first time mom, you are likely to go over. So that lessens that risk a little bit, but there is a risk. You definitely might have your baby then. Think about that. And if you're comfortable, we're happy to sign you. And we have people that sign. And so I think that being in obstetrics is just, it's so important to be clear with your people and let them take the risk on that they are willing. And if you don't have any clients sign, then I think it just wasn't meant to be. Go enjoy your vacation. Don't check out. Have a great time and come back really refreshed.
Sure. Those are all boundaries are important.
Mm-hmm.
So definitely important. What are any misconceptions about a doula that you see that you think need to be cleared up? One or two misconceptions.
Yeah. I think that the number one misconception is doulas are only for the crunchy, unmedicated people. And that's not true. And I'm really glad that we busted all the myths about how does that support actually look in different types of birth, because doulas maybe originated that way. Maybe they were primarily in home births or primarily in birth centers, but that's not true anymore. And women are really finding the benefits of having a doula. You have less C-sections, you have less interventions, you are happier with your birth, so you have higher satisfaction.
Sure.
Having a doula has a lot of benefits for a lot of different type of births. And I think that it's about finding a doula that makes you feel safe and can actually help you achieve your goals.
Yeah, I love that.
And then the second one I think is that doulas and doctors don't get along. I cannot tell you how many people ask in their interview. And I do think that it's an important question, but they will say things like, I know that doulas, sometimes don't always get along with doctors. Can you tell me how you interact with medical staff? Can you tell me how X, Y, and Z? And I hate that is part of our reputation. It has been fairly earned. I know that there's a lot of doulas out there that they disrupt the birth space more than they put into it. And that's really hard. But I think it goes back to maybe needing those standardized credentials of, okay, this person has this education and this person has this experience and they are keeping up with this continuing education. That's another thing our team does. And so it's important to have standards to hold people to. And I think hopefully we're headed in the right direction, and there are really great OBs out there, and we're seeing a lot of good relationships form. It really jazzes me up.
Oh, I love that. And that was my next question. Like, what are some, I guess, good things? And do you still see though challenges with the care that people receive? Like, if you could, report you're being a fly on the wall in the middle of birth experiences, what are some things that you see that still make you go, oh my God, I really wish that this would stop?
I think really the lack of consent. So I'm so big on language. It's so easy to change language. It really is just keeping it at the forefront of your mind. It's not hard and it doesn't cost anything. It's really just about remembering. So instead of saying like, okay, Megan, it's time for your cervical exam. It's been 2 hours. It is so simple and easy and free to change it to, hey, Megan, so it's been about 2 hours since your cervical exam. The hospital says that we should check in and do one every 2 hours. I know that we had talked previously and you didn't love the idea of cervical exams. Do you want one? And she says, I really don't want one, but do you need one? And you go, no, I don't need one as your doctor. But if you wanted to see where you were, or you wanted to hear my opinions on maybe where you're at now, then a cervical exam would be helpful. And she goes, no, I'm all set. And you go, okay, great. Like, how much more human was that? That was just so much better. It makes someone feel safe. It makes them feel secure. So I think that's the number one. And then I think, gosh, it's so unfortunate, but the number, and it could totally be me. This might just be confirmation bias, but the number of people who report that their doctors do sweeps or break their waters when they only consented to a cervical exam is so traumatizing to me, because we just see it so often. We have a membership called the Birth Lounge, and at any given time, there's about 300 to 500 people in there. And so we are always getting birth stories, and it just feels so archaic. Like, come on, this is so easy not to do. And it's still happening. So those are just two challenges that we're still teaching women how to say, like, okay, I am okay with a cervical exam, but I want to make it very, very clear. I really don't want a sweep or for you to break my waters if you don't mind, please. Right? And they go, yeah, cool.
It's not confirmation bias. It still happens. It's just that we don't, we're just not taught that. This is going to sound awful, but we're not taught that we even need to ask. So, I mean, for years I did that. I've never been like a mean person. I've always felt like, but hundreds of times I walked into a room and said, I'm here to check your cervix, and just went forward, because my training never said like, you need to stop and actually ask if it's okay. This is a deeper, bigger thing, but it's just an underlying reflection of the way women in society and their choices are not felt. We don't have to ask sometimes about the things that we do. So I think we're changing that, but it's still a big issue I never, and even in discussion with some of my colleagues, we just never realized like, oh my God, like, no, we actually aren't asking. Like, what are we doing? Like, this is, this is an easy thing that needs to happen. And I didn't realize until I started doing this online work in the podcast, how many birthing women people really feel like that's a big sticking point that we don't even recognize as an issue. So anyway, I just kind of went off on a tangent there just to say that you're not making it up in your head. I think that's still an issue that happens for sure.
I appreciate that. And I think that it's really important that people, doulas included, nurses, doctors, anesthesiologists, anybody chiropractors, acupuncture, if you have cared for and you touch pregnant people, you need to always be evaluating your practice, because we all do harmful things, totally not intentional. But once somebody comes to you and says like, hey, that really impacted me in a way that I don't know that you realize, or maybe you did realize, and I wanted to just let you know it got to me. You should really kind of sit down and think about that. So from me as a doula and me as a patient who does get OB services, I'm very grateful to have OBs like you and all practitioners that kind of constantly reevaluate your practice, because that creates a safe environment. That's how we do it.
Yeah. When we know better, we have to do better.
Totally.
Yeah. So as we wrap up, what would you say is the most frustrating part of your work?
The most frustrating. Oh my gosh. You really want to know?
Come on now. You got to.
Okay. It's 39-week inductions that don't need to happen because, oh my gosh, it's just the anxiety that it causes our team. And it's anxiety for you because we want you to have a good birth. We are just hoping that this goes in a good way. We trust you. If this is really what you want, we totally trust you, but we just we kind of hold our breath like, oh, we hope this goes good. That really is right now. That is the most frustrating thing.
Yeah. Yeah. Our hospitals in this area, actually a couple don't even do 39-week inductions because it's just too, if it's necessary, but like elective, just because it's a lot of, it's time and it just, they just, especially if someone is not ready. So I totally understand that. Yeah. 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 And then on the flip side, what's the most rewarding part of your work?
Oh my gosh. The most rewarding part. Oh, can I say two?
Yeah.
Okay. So one is seeing people birth their babies and they go, I did it. And you're like, I know.
Right.
I knew you could do it the whole time. I knew this was going to be the result. This is why I kept pushing you. You did it. Right. Absolutely. The second thing is seeing the light bulb moments in medical professionals, because I do understand this is not how you're taught. I do understand we're asking you to step a little bit outside of the box. And so when I'm able to connect the dots for somebody and they go, oh my God, I go, I know.
Right,
Isn't this crazy? And it goes back to when you know better, you do better. And when you do better, you feel better about your job. You feel better about the care you're given and yourself and your skills. And then everybody wins.
Yeah. Yeah, definitely. For sure. So what is your favorite piece of advice that you would give to an expectant mom?
My goodness. Don't be afraid to use your voice. You do know what you're doing. You really do. You may need a little educational support. You may need a little advocacy support. You may need a couple conversations. You may need some time to think about it. But you should listen to your intuition and your gut and your mind and your brain and your heart and make the decisions that you know are right. And put together a team of people that support you and are aligned with you. But listen to your heart and use your voice.
Excellent advice. So where can people find you? Where are all the things that you offer?
Where are all the things? Okay, I'm on Instagram at Tranquility by HeHe. You can find our membership at the.birth.lounge. I'm also the host of the Birth Lounge podcast, so you can go to the Birth Lounge podcast anywhere that you stream, or thebirthlounge.com, which is, again, our childbirth membership to help you have an informed and confident birth and know how to be able to respectfully navigate hospital policy and have these conversations with your provider that are really going to center your voice and help you achieve the birth that you want, whatever that looks like for you.
Awesome. I love it, love it, love it. Thank you so much. This was an incredibly informative conversation. I appreciate it.
Thanks for having me. This was a blast.
Wasn't that a great conversation? HeHe has such lovely energy. You can tell she gets really excited and is passionate about this work that she does. Now, after every episode when I have a guest on, I do something called Dr. Nicole's Notes, which are my top takeaways from the conversation. Here are my Dr. Nicole's Notes from my conversation with HeHe. Number 1, doulas should facilitate discussion and not make decisions for you. They should help you use your voice and center your voice. And I see this play out in 2 ways. One is when those instances where the doula is a bit aggressive. So she does all the talking. She barely lets the patient talk. Any questions that come up, she's like, getting into the conversation and not really helping the patient to use their own voice. Now, don't get me wrong. Sometimes there is a role definitely for doulas speaking up, but really it should be starting with helping the patient to use their own voice. So that is one way. That is the less common way that I see this play out. Actually, the more common thing that I see is that the doctor comes in, the patient has a doula, the doctor proposes an intervention like breaking water or Pitocin, and then the patient looks at the doula and says, well, what should I do? Okay. And you shouldn't expect that your doula is there to make decisions for you. They can help you think through things and talk through things, but you really shouldn't look at them and be like, so tell me what to do. That's not fair to you, and it's not fair to your doula in order to expect her to do that. So again, doulas should facilitate discussion. They are not there to make decisions for you. Number 2, ask questions before you hire a doula, so that you know exactly what you're getting, how things will work. Check out episode 218 of my podcast, where I go through a list of questions that you need to ask before you hire a doula. And if you're inside my online childbirth education class, the birth preparation course, then I have a nice printout that you can use when you go to hire a doula of the questions that you can ask and a step-by-step process to choose a doula. The birth preparation course is, of course, my online childbirth education class, and you can check out the birth preparation course at drnicolerankins.com/enroll. Or check out that episode 218 of my podcast where I talk about the questions as well. That's drnicolerankins.com/episode 218. And then the last thing I want to say is it is so important to set boundaries. HeHe set boundaries around when she's available and when her team is available. And certain times they just aren't able to provide support. That is what she has decided works best for her. And we all have to learn how to set boundaries in our lives. And remember that boundaries aren't actually for the other person. Boundaries are actually for you, to help you create the life that you want, help you create the experiences that you want. A common place where I see that boundaries may need to be set surrounding birth is visitors, whether that is visitors in the hospital, whether that is visitors at home, whether it's who can be in the labor room while you're giving birth. Again, it's not about hurting anybody's feelings or anything like that. It is about creating a situation where you feel good and you feel most comfortable. So get comfortable setting those boundaries in your life. So important. Okay, so there you have it. Please share this podcast with a friend. Sharing is caring. It helps me to reach and serve more people. Also, subscribe to the podcast wherever you're listening to me right now. And do check out those resources. I told you about my free birth plan class. You can check that out at drnicolerankins.com/birth plan, or the birth preparation course at drnicolerankins.com/enroll. So that's it for this episode. Do come on back next week, and remember that you deserve a beautiful pregnancy and birth.
Prescription products require completion of an online medication consultation with an independent healthcare provider through the LifeMD platform and are only available if prescribed. Subscription required. Individual results may vary. Additional restrictions apply at lifemd.com. Read all warnings before using GLP-1s. Side effects may include a risk of thyroid C-cell tumors. Do not use GLP-1s if you or your family have a history of thyroid cancer.
Should GLP-1 weight loss medication like Wegovy and Zepbound cost thousands of dollars? We don't think so. TryLifeMD.com helps provide insurance access to the leading GLP-1 medications. Visit TryLifeMD.com and check your eligibility for GLP-1 medication with copays as low as $0. Listen to Bridget's story after losing 55 pounds and using her insurance for coverage.
LifeMD helped me get covered with my insurance. Finding out that it was covered was huge. I've lost 55 pounds. I am so much healthier now that I've lost the weight. I would never be able to do it without them.
Get started today and check your eligibility for GLP-1 medication with copays as low as $0 at TryLifeMD.com. That's TryLifeMD.com.